Thanks, guys. My name is Aidan. I am the Chief Commercial Officer of Naluri. We are a digital therapeutics company that helps people manage their chronic disease risk and improve our mental health of our members. So long before global pandemics dominated headlines, there existed another silent pandemic claiming tens of millions of lives a year. Non-communicable diseases such as cardiovascular disease and diabetes affect over 1 billion individuals in Asia, causing an economic burden of over $100 billion US. Now, coupled with medical inflation rates that are among the highest in the world, there now exists tremendous irony for insurers and employers who are paying more and more every year for care, yet people are getting sicker and sicker. While the existing healthcare model is effective at treating acute conditions, it is extremely ineffective at treating chronic conditions, which require long-term structured care. The existing healthcare model suffers from 3 key shortcomings. First, it is reactive and transactional, where patients seek care only really when they're sick. Secondly, increased specialization in the healthcare ecosystem means chronic disease patients typically do not get the multidisciplinary care that they really require. And thirdly, wellness programs tend to focus on activities rather than quantifiable health outcomes. Now, while the shift to telemedicine solves issues related to accessibility, it still does not solve these 3 key issues. At Naluri, we believe the future of chronic care management is a world where there is proactive and long-term structured care for patients that integrates both physical and mental health and focuses on outcomes instead of activities. It's been shown that holistic lifestyle modification, and it's been proven that these things are extremely effective, but it's typically very, very expensive. Naluri solves this by digitizing the entire process to make chronic disease care as affordable as ever. Naluri greatly improves the productivity of health coaches by shifting conversations to asynchronous, text-based chat to allow coaches to serve 10 times the number of patients than before. Furthermore, the proprietary Naluri brain augments the coaching effectiveness of coaches by using machine learning to personalize their coaching at scale. The Naluri program has been shown to be effective at improving health outcomes both in physical and mental health markers, which reduce chronic disease risk and healthcare expenditure over the long term. And with this data, corporates and insurers are finally able to quantify health expenditure savings and reprice their risk. We started in Malaysia 2 years ago and have quickly expanded to Singapore and Indonesia, where we have partnered with the largest corporates, insurers, and pharmaceutical companies and healthcare providers. Having recently hit our $1 million ARR milestone, we expect to continue growing 3 to 4 times year on year. We've assembled an incredibly experienced team who have built and IPO'd companies in the past, worked for the top consulting firms in the world such as McKinsey & Company, and who have deep experience in healthcare, psychology, and tech. Here at Naluri, we have really ambitious plans. And over the next year, our key goals are to, number 1, further validate the efficacy of the Naluri program through clinical trials. Number 2, build strategic partnerships with companies and expand geographically. And 3, continue investing in the Naluri brain to further strengthen our IP. But most important of all is us staying true to our core goal, to help people achieve their healthiest and best selves. Thank you.
Okay, thank you so much for great pitch. Let's start Q&A. Yes, please, guys. Who would like to be the first one?
Can you repeat, please, and tell us about source of your revenue, please?
Yeah, so we're predominantly a B2B company. So we work with 4 key types of groups of people. The first is corporates. And what we do with them is we basically help them manage their healthcare cost expenditures, which is escalating in this region between 10 to 15% year on year, and improve productivity of their employees. We work with insurers, and we basically we help keep their policyholders healthy and therefore reduce their claims ratio. We work with pharmaceutical companies to augment the effectiveness of their medication. And finally, we work with healthcare providers to close the loop of care and provide healthcare out of hospital or post-hospitalization. So it's normally a subscription per member per program.
As I understand, you have more than 1 million in revenue, yeah, for the last year.
Yeah, so we just hit $1 million annual run rate. Over the past annual year, we're at about $800,000, but at the moment we have an ARR of about $1 million.
Okay, and geographically, your revenue from which countries?
So we're based in Kuala Lumpur in Malaysia right now, and we have a geographical presence in Malaysia, Singapore, and Indonesia. And we have plans to expand to the Philippines and Thailand very soon, as well as Australia and potentially Japan.
Okay, thank you.
This is Vikram from GHV. What's your LTV for the customers? Lifetime value of your customers?
Yeah, so typically our customers are between 100 and 200 US dollars per program. And basically we see them kind of graduate the program after a period of about 4 months to a year. The idea is most of our members typically graduate the program, and so we typically have a fairly high success rate. So we don't see them having reliance on the program for kind of a long period of time. We typically graduate them on after a period of about 4 to 6 months.
And what's the CAC?
Pardon, the customer acquisition cost?
Yes.
It's roughly about a third at the moment of our revenue.
Okay, thank you.
Okay, thank you so much. Any other questions?
Yeah, just a very quick one. What's the drop rate of the people you onboard on the coaching? Because that's usually the problem.
Absolutely. So the reality is not everyone graduates from the Naluri program. After a period of about kind of 4 to 6 months, we see about 70% of the individuals achieve what we call a clinically significant outcome. And of course, we're trying to push that higher, but the reality is, I don't think it'll ever be 100%. At the moment, that kind of 60 to 70% success rate is a figure that our corporate partners are particularly happy with at the moment. So we'll try to get that up, but so far so good.
And for the coaches that you onboard, are they like employees of Naluri or consulting?
Absolutely. So this is incredibly important, right? Because we're not a telemedicine company or platform. The coaches that we have are full-time Naluri employees, and they're trained in kind of how to provide long-term digital care. The idea is to ensure that they kind of build a relationship with the user or the member, and not have a transactional conversation with them kind of once in a while, like we see typically in telemedicine platforms.
And lastly, like, do you envision like expanding to other areas, to other diseases, like to apply this model?
Absolutely. So I think probably the next couple of areas, and we focus on chronic disease, so hypertension, diabetes, hyperlipidemia, et cetera, as well as mental health, very importantly. But we do foresee us kind of going down different clinical pathways, such as oncology, pretty soon.
All right, thanks.
And what is your future plan in terms of exit? Are you looking at an IPO, an acquisition?
So the likelihood is we're thinking that probably an acquisition is more likely than anything. We see probably 2 potential exit routes. One would be, for example, through an insurer, where we can basically be bundled with their products, making sure that we keep the policyholders healthy, therefore kind of reducing the risk of payout. And potentially a second other exit would be through the pharma route, where we can be bundled with some of their medication to kind of augment the effectiveness through improved medical compliance. Medicine compliance.
And languages, do you have any different, like how many languages are you able to communicate with? And
yeah, so also very important, like every country that we're in, it's hyper localized. So Malaysia, for example, we do English, Bahasa Malaysia, and Mandarin. In Indonesia, for example, we have Bahasa Indonesia. And part of why we haven't yet entered certain countries like Thailand is because we're taking the time to kind of ensure that we build the correct coaching base who can speak the local language, because that's incredibly important. So it would be localized to each individual country.
right.
Thank you very much.
Thank you.
It was great. Yeah, it was
May I
great.
also ask?
Oh, sure.
Yeah, okay.
So maybe I missed the amount of money that you would like to raise. Can you clarify
Sorry,
that?
we are broadcasting in many countries where raising questions in some countries are prohibited. So please ask those questions in chat. You're able to chat with every participant.
Happy to take this offline.
Yes,